One of the big things that we've been facing recently are the national drug shortages, especially of all the injectable opioids. So when we were faced with that challenge, one of the routes that came up was using the rectal route. And of course, anytime you talk about the rectal route, there's an understandably reluctance to want to use it. It's an invasion of privacy. Any medication that's given the rectal route has to be done so repeatedly, so it's a repeated invasion of privacy. Suppositories are not comfortable to give. They can cause trauma, and they have to be given correctly. If they're not given a certain way, then you can't guarantee absorption. So those were our immediate thoughts. When we first heard about the Macy catheter, our mind jumped to our past experiences with the rectal route, so that's what first came up. And because of that, we're a little leery. That's when we brought the Macy Catheter folks in and learned about it and gave it a shot. And from there, it's been amazing.
I didn't see that there was any possible way that another route of medication administration could be any better than what we were currently providing. Mainly, specifically, a very narcotic parenteral medication heavy process. We function on the level of a hospital here. And I didn't realize there was something better than what we were already using. This is a whole new level of practice, and I will never go back to the practice that I had before. And I just cannot emphasize enough. I can get people comfortable. I can keep people comfortable. I'm not accelerating medicine. I'm not adding medicine. You get the Macy in, you give them medicine, they're comfortable, and that's it. You know, it's not this aggressive acceleration with side effects, and people are just comfortable.
We've been noticing that we have to do less opioid rotation, and there's less of a titration of the dose. So we've been able to meet all three of our goals, the kindness, comfort, and compassion with the Macy catheter. And actually at this point, our injectable use was high. Now we've slashed it almost 80%. It's amazing, yeah, 80%. And I don't see us, even once the shortage is relieved, I don't see us going back to using the injectables like we had been doing.
Less cost, less waste, not having to poke them, not having to maintain a peripheral IV, not having to use subcutaneous injections. You put in the Macy, you have excellent absorption, you have excellent patient comfort, and people pass away very comfortably.
The Macy catheter has had a huge impact at Ohio's hospice. Now we have the Macy catheter. We can teach families. They can take their loved ones home and use the Macy catheter. Before we would train them on IV push medications, and it's not easy and it's scary. This makes it easier for them, for families and loved ones. For nurses, it's amazing because we now don't have to wait for somebody to come and waste. We are not wasting as many narcotics as we used to. The push is a quicker push, so they're pushing the medications a little bit quicker, or a lot quicker compared to IV, and now they have more time to spend at the patient's bedside giving compassionate care.
Well, the first time I used the Macy catheter here at Hospice House was with a patient who came in with pancreatitis, and they had come straight from the hospital. And in the hospital, it's loud, there's alarms, there's noise, there's anxiety, there's vital signs, there's interventions, there's procedures. Everybody comes from the hospital high-strung and agitated and uncomfortable. So this poor little lady came in, pancreatitis, she couldn't swallow, she had incredible nausea, her belly was distended. And the family was distraught and wringing their hands. And I said, hey, we've got this Macy catheter that's beneficial. I offered the Macy catheter, we put one in, and within like 15 minutes, the whole room relaxed because the patient relaxed.
We now have a tool that we can pull out. We can insert, we can give medications without having to stick people. Families and patients don't like needles. And this is not a needle, and it's very comfortable. I haven't had any patient that seemed like it's disturbed them at all. Most of the time they don't seem to even notice that we've put it in. This is a catheter I would use with my own family. I would put this in my mom without a second thought.
Even the nurses that were the holdouts. I talked with one nurse this week just preparing for this conversation and said, you know, hey, like, tell me what your thoughts are. She says, I wanted to hate it. I didn't want to like it, and I love it. And I mean, they just, the nurses are on board. And when a patient can't tolerate a Macy, it's almost like oh, that's really sad. Like for them, it's really sad because we can get them comfortable, we can keep them comfortable, easier, longer, with less aggressive, less adjustment, less acceleration, and it works.